Welcome to Hard Talk. I'm Stephen Sacker. Much of the world responded to the COVID-19 pandemic with a lockdown strategy. Now, the focus is on finding a way out of lockdown without prompting a second wave of infection. Could Sweden provide a model? Well, my guest today is Sweden's chief epidemiologist, Anders Tegnell. Now, he was the architect of a controversial no-lockdown strategy, which continues to stir interest right across the world. Has it worked? Anders Tegnell in Stockholm, welcome to Hard Talk.
Thank you.
Let's begin with the latest picture in Sweden. Your death figures every day from COVID-19, they go up, they go down, sometimes by quite significant margins. It's hard to get a real sense of whether you are really in control of the spread of COVID-19 in Sweden or not. What do you say?
Yeah, we know that the death toll is a bit complicated to follow because the registration of deaths is sometimes a few days late. So what we do is that we now collect data on actual date of death. And we do it in that way that we don't look too much at the last 10 days because we know they are very unsure. A lot of things happening and they fill out every day. Instead, we look at the days before that and then we can follow the trend much better. And we have a very clear declining trend. I think we topped just under 100 cases a day, and now we are down to slightly more than 80 a day on the average. And the trend seems to be keep going that way. And
that trend is clearly very good news, yeah. But is not the brutal truth that you have had many more deaths in Sweden than you would have had if, like your Scandinavian neighbours, you had imposed an early and very strict lockdown policy?
I think that's very difficult to know. I mean, the death toll in Sweden is mainly in the long-term facilities for long-term ill elderly people. And we had very much an unfortunate spread in those facilities in a way that some other countries had, but not our Nordic neighbors. And why we had a spread in Sweden and not in our other neighboring countries, that's something we're trying to investigate now.
But with respect, Dr. Tegnell, isn't that part of my point, that you probably would not have had that catastrophic spread of COVID-19 through your care homes, particularly around Stockholm, if you had run a more strict, a less open policy for the general population?
Yeah, I mean, these people meet a lot of people, even if you have a lockdown. So you can't isolate them. So in that way, a lockdown would not have stopped the spread into them. And we can see now when we are starting to look at these places, we see a decline in the incidence in those places once we start really focusing and getting them to focus on basic hygiene procedures and so on.
Let me ask you this. As the country's chief epidemiologist, the man, let us be honest, the man who in many ways is the architect of the Swedish government's strategy for coping with COVID-19, can you regard a situation in which your country has getting on for 30,000 infections of COVID-19 in the population, has a death toll which is significantly higher than your neighbours, standing at around 3,500. Can you regard that as success, or do you have to acknowledge that in some ways your strategy failed?
Yeah, no, that's true. When it comes to the death toll, this didn't work out the way we hoped it. On the other hand, I mean, the connection between our basic strategy in slowing down the spread, if that really in the long run will affect the total death toll in a society or not, that is not clear yet. I mean, we know that our neighboring countries by now have around 1% of the population who had some kind of immunity has had the disease. The investigations we have had in Sweden so far, we have a major one going on to give us a better answer, points to that we have at least 10, maybe 20 times higher level of immunity in the population, which means that we are much further into the spread than our other countries. And if that will mean that the other countries will reach similar death tolls to us or not, I think that's very difficult to judge.
That is a very interesting answer, because you're inviting me there to consider the long-term significance of this notion, this concept of herd immunity. Now, your own government says that the strategy that you implemented, the more moderate, the less strict emergency response to COVID-19, was not about establishing herd immunity. But you seem to be suggesting that actually it is about getting to that point where so many people in the general population have had COVID-19 and therefore we can assume have some resistance to getting it again, that you have this concept of herd immunity in your population. Was that the working strategy or not?
No, it was not. I'm just pointing out one way that shows that you cannot make this kind of easy comparisons at this stage, because the epidemic has hit different countries in many different ways.
The point is really about comparisons with your Nordic Scandinavian neighbours, because they took a very different approach. They were much stricter in their lockdowns, as you've acknowledged. And the death tolls, well, Denmark just over 500, Finland just over 200, Norway just over 200. They are strikingly different from Sweden's. And the point really is that they now feel that they're in a position to ease their strict lockdowns, to bring some sense of normality back to their populations. And to quote one of the senior ministers in Denmark, they feel that there's very little chance of a second spike in infections because of what they've achieved. So they're as far along the curve as you are, but they've prevented hundreds and hundreds of deaths that you failed to prevent.
But I don't really understand what you mean that they're as far along the curve as we are. Obviously they are not. If only like 1 or 2% of the population has been infected, they are not very far along any kind of curve.
But they're very confident that because of the measures that they took and the social distancing and the public consciousness that they now have, that the disease will not spread and will not kill the numbers that have been killed in Sweden.
Yeah, and only the future can tell. If we look at other kind of similar kind of diseases, we have never really been able to stop anything. We can sometimes delay things, like they have been very successful in doing in our Nordic neighbors. But to stop them forever, I don't think that's going to be possible with COVID-19, just as well as it's never been possible with flus or any other kind of viral diseases in this way.
We'll come back to your vision of the future in a moment, but I am very interested in the more philosophical point that your approach has tested, and that is the notion